My name is Damian Scullion. I'm Associate Medical Director for Anaesthetics, Theatres and Intensive Care within the Southern Trust. I'd just like to update you what's happening in our department over the recent days as the number of coronavirus admissions to intensive care increases. This is in line with predictions, as we do lag behind, about 2 weeks behind normal admissions to hospital, as patients get sicker and eventually require our services. Since the first surge, we have been doing our best to maintain theatre activity within the 3 sites in the Southern Trust. But unfortunately, as the number of admissions to intensive care increased quite dramatically last week, we were unable to do that. We had to step down theatre activity to a considerable extent. The reason we've had to do this is we've had to redeploy staff from theatres to critical care to provide support for the patients that have been admitted to intensive care. Currently, we have more than twice the number of patients in intensive care that we would normally have. I'd like to commend the nursing, medical and support staff who have been redeployed for their commitment and flexibility in working in environments that are not familiar with them, and also particularly to the critical care staff who provided support and education to the redeployed staff to ensure that the patients being admitted to intensive care receive the best possible treatment. It is important to note that relative to the first surge, we have many more patients in intensive care who have non-COVID issues, as opposed to what happened in the first surge when the majority of patients were COVID. I'd like to reassure everyone that it is our intention to resume normal activity as soon as it is safe and feasible to do so, so that the patients will receive the treatment and surgery that they require. In the midst of all this doom and gloom, there has been hope this week with the announcement of the development of a vaccine which will be available in the coming months. In the meantime, however, I would like to advise everyone against complacency and continue to adopt practices which mitigate the proliferation of this vaccine in the community. And these include social distancing, meticulous hand washing and the appropriate wearing of face covering. By adopting these practices, we can reduce hospitalisation and help guarantee that our critical care services do not become overwhelmed in the future.